I have a friend who has von Willebrand disease, or not. He sees or never sees his hematologist regularly. He sometimes takes or never takes medication to help stop bleeds that he may or may not have. So who is this mystery man, this Jekyll and Hyde? The answer is he's one of millions of people who has some degree of uncontrolled bleeding, but he's never been diagnosed or treated. Everyone, that is not okay. With all the advances in healthcare, with all the moves towards personalizing medicine, millions of people with VWD are undiagnosed. Wow. Calling in today to help us sort this out, we're very honored to have Dr. Jonathan Roberts, who's a hematologist-oncologist at the Bleeding and Clotting Disorders Institute. Dr. Roberts works hard every day to develop diagnostic assays and other diagnostic tools for von Willebrand, so more people can be properly evaluated and treated if they need it. And so people like me don't burst a blood vessel right on the air because they care too much about this issue. Dr. Roberts, welcome to Beyond the Bleed.
Yeah, happy to be here.
Dr. Roberts, what initially drew you to hematology?
Well, actually, I have severe hemophilia A.
Oh, wow. So this is very personal to you, this work. You must feel very passionate about it.
It's the driving force that got me into hematology and one of the motivating factors in taking care of patients and also in the research that I do.
Wow. Yeah, I can imagine you offer a special insight to your patients.
Yeah, I feel like I'm not just their physician giving them treatment recommendations, but they actually feel like, to some extent, that I've walked in their shoes and that we can, even if we have different bleeding symptoms, we still have kind of a common bond.
It feels like uncertainty is a big part of a von Willebrand disease diagnosis. So do you have a lot of patients living with uncertainty, and how do you help them with that?
You know, patients a lot of times come to me with uncertainty, especially when they're undiagnosed or don't have their specific subtype of von Willebrand disease diagnosed. So what I really try to do, especially on my first and even in subsequent visits with patients, is really to get on the whiteboard and draw out the pathophysiology of von Willebrand disease and really give them kind of a mental picture as to what's going on with their disorder, and then talk in a lot of detail about the different treatment modalities that there are, because there are many things we can use to manage von Willebrand disease, and really tailor therapy specifically to what bleeding symptoms that they're having, because von Willebrand disease is such a heterogeneous disorder, so meaning that patients can have very mild bleeding symptoms to very severe bleeding symptoms, and can have anything from really frequent nosebleeds to heavy menstrual bleeding, severe bruising. Sometimes even in more severe von Willebrand disease, they can have joint and muscle bleeds like patients with hemophilia have.
So there's so many moving parts to this. It sounds like that's a huge challenge of dealing with von Willebrand's. What do you think needs to happen to improve diagnosis?
We are actively involved in actually giving lectures to OBGYN groups. Sometimes they're grand rounds, or we work closely with our ear, nose, throat colleagues, because patients can have diagnosis of von Willebrand disease after a tonsillectomy, adenoidectomy, or from the nosebleeds. And then also a lot of primary care physicians that recognize, like, the young child or even adult that has easy bruising. And so we try to let them know that we're there, we're available, and that some of these milder bleeding symptoms really should not go ignored, and that they really warrant evaluation. And so we do a lot of outreach to the community with our other colleagues in the medical field to really let them know who we are, what we do, and really that von Willebrand disease is the most common inherited bleeding disorder, and there's lots of patients out there that are undiagnosed.
So how do you educate with such a these varying symptoms and varying treatment options? How do you educate your specific patients about their own diagnosis and treatment strategy?
I think this is another reason that patients with von Willebrand disease should be referred to hemophilia treatment centers. So, at our center we have the time that we can focus on patient education, and I make sure that with newly diagnosed patients and even patients that have had a diagnosis for years, that we are, drawing figures on the whiteboard and helping them explain and understand the pathophysiology of von Willebrand disease, so that we can really empower patients with really understanding what VWD is and the different therapeutic options that are available.
And speaking of what's available now, what do you hope for the future?
You know, I think 5-10 years down the road, I hope that we are able to bring more awareness of VWD and really help patients that are undiagnosed with mild bleeding symptoms get to hemophilia treatment centers where they can really receive optimal care.
Absolutely, I hope the same thing. Thank you so much for the work you do, and thank you for being here.
Yes, it's a pleasure. Thanks for having me.
It's all my pleasure. Your perspective is very unique and very needed. You're a patient, you're a clinician, and you're a researcher, so you kind of got the whole package, and I'm sure our listeners got everything out of it that I did. And to our listeners, please check in with us again next time on BeyondTheBleed.com, and have a great day. I think Dr. Roberts gave me some hope today. More than I had when we started this podcast, that's for sure. For one thing, I know incredibly smart, dedicated people like him are working really hard to advance the science and art of diagnosing von Willebrand disease. That's it for today from Beyond the Bleed. I'm Erin Rein. Stay strong and stay tuned.